First confirmed case of COVID-19 arrived in La Crosse 1 year ago today.
News 8 Now's Isabella Hulsizer has a look at all that's changed between then and now in our community.
We have been notified as of this morning of our first confirmed case by lab test.
March 18th, 2020.
We had been preparing for probably a couple weeks at that point, knowing that COVID had come into the United States. We were kind of just making sure that we were ready for when we had a case, because it was more a question of when, not if.
As time went on,
health officials continue to learn more about COVID-19.
Guidelines changed.
We tried to rely on the science, and what was great was the science did evolve over the year.
The local health system started screening patients and staff at the door. The county health department asked people to wear masks, practice social distancing, and wash their hands often.
Of course, when you see the disease rates start to go up and you see a lot of cases, that was another big challenge for us.
The 7-day case average is at 57.
Our disease investigators were ready to call those cases and to talk them through what kind of the next steps were.
And I think as things went along, we very rapidly figured out that we need to learn how to treat COVID and really limit the spread of COVID.
What Dr. Rathgaber calls liquid hope is helping that cause.
It's very gratifying to have the tools we know work, and all we need now is the supply, of course, of the vaccine.
Health officials urge everyone to roll up their sleeves when it's their turn.
I would recommend people get their vaccine.
A year and almost 12,000 confirmed COVID-19 cases later, the county health department is happy to report that 26% of county residents have received a vaccine. It's hard to say when the entire community will be protected, but we've made so much progress in just 1 year.
It does feel like we have a light at the end of the tunnel.
There's reason to hope March 2022 will be better. In La Crosse, Isabella Hulsizer, News 8 Now.
It does seem like a long time, and officials at both healthcare systems say now that case rates are getting better, they do encourage patients to get back into the routine of attending their regular appointments, health screenings, and getting their vaccination.